So when I meet a patient, or I meet a person, I see you as a whole individual. So a holistic approach means that I'm not just focusing on one thing, to the little thing. No, I'm going to look at you as a whole. I'm going to look at your skin. I'm going to look at your hands. I want to observe when you're speaking to me. Is there some neurological thing? Because your teeth are connected. They're organs. Each tooth has layers that are part of your entire body. So when you're a fetus and you have 32 buds and you're developing, that goes from the tip of your toes all the way to the head. So women, we love to get pedicures because when we get massage on the feet, every single organ and every single meridian is being stimulated. Do you know that? So what happens is that all the teeth are connected to different organs. So when a person comes first, we know that the gums are the baseline of the foundation of a house, right? So if your gums are infected, that lining, that inflammation, that inflammatory response to bacteria that your body's having is increasing the C-reactive protein, which is an indicator of inflammation. That's an indicator of aging and of disease. So we say, let's start with the basics. Let's clean you up, clean the gums. Most people don't know how to brush and floss and clean their tongue, believe it or not. Once we teach them, they're like, wow, nobody ever spent an hour telling us that. So we start with the basics of the lining. Now the teeth are the second component, and then the bone is the third component of the mouth, right? You have the teeth going into the bone. So if the teeth are decayed, the bone is going to get the infection because that infection is going to go through the bone, through the arteries, through the nerves. Now, if you have a neurotoxin, like a material that is neurotoxic, right? Mercury is a neurotoxin. Aluminum is a neurotoxin. There's many things that are neurotoxic, but do you want to have that in your mouth? Do you want to have chewing with mercury fillings and releasing 4 micrograms of mercury every time you eat garlic or eggs or onions? Anything that has sulfur is going to bind the mercury. The mercury crosses the brain-blood barrier. So we have patients that have neurological conditions. And then the doctors are sending the patients, can you please see if the patient has mercury, aluminum or lead? Can you please remove all that out of their mouth? Because if a doctor wants to do a detoxification fulcalation, which is the drawing of metals out of the body, because the blood work is showing high levels of toxins, the doctor would fail and the patient will get sicker if they're doing detoxification process. Because if you have it in your mouth and you're pulling it, it's going to go deeper into the organs. If you have mercury toxicity and you're chewing and eating delicious foods like, garlic and Italian food, garlic, onions, asparagus, anything with sulfur is going to bind the mercury. That is going to change the gut bacteria. So most people that have mercury, they have a dysbiosis of the gut. They don't know. They think they have I have something in my, my gut. I have all this. They have names, all these diseases. Well, they have an overgrowth of yeast candida because that's what happens when you have mercury in your mouth. Your body's going to produce yeast to protect your kidneys, not to get the mercury into the kidneys, because if you get mercury into the kidneys, you can actually go into kidney failure. So these are all things that are related, and doctors that are more sophisticated in the knowledge of how materials, nutrition, metals, and toxins affect the cells, they know that mercury not only is a neurotoxin, but also affects the mitochondria, which is the part of the cell that produces energy. The mitochondria is not able to produce energy. So most people that have mercury, they're fatigued. They're fatigued. They have chronic fatigue syndrome. They have autoimmune. The body doesn't know what to do. And there's a whole list of things that the American Dental Association, a list of things that are already accepted and related to the mercury toxicity, like thyroid problems. The mercury competes with iodine because they are both the same symbol. Like if chlorine has 2, mercury has 2, and iodine has 2, they compete for the same site. So we find that people are becoming more sophisticated and more knowledgeable because they're trying to find a solution. They are becoming more knowledgeable and sophisticated to think, wait, the only spot I didn't look was the mouth. So they're sending their patients, Dr. Cintron, can you please check the mouth and eliminate any toxic loads and infections in the gum, may be affecting the heart, the lungs, the thyroid. So that's what a holistic biological dentist does. That's what I do.